Alright, welcome back to our unit on autonomic drugs. So far, we've covered the drugs that modify the effects of the parasympathetic nervous system, and it's time we moved on to the sympathetic nervous system. You know, there's nothing that represents the nervous and exciting energy of the sympathetic nervous system quite like those awkward preteen years spent at summer camp. Remember summer camp? The camaraderie, the pranks, the classic rivalry against the wealthier and athletically superior camp across the lake? Well, the memories are all about to flood back, I promise. The sympathetic nervous system is an important regulator of virtually all organ systems, and is particularly key in the regulation of blood pressure. The ultimate effects of the sympathetic stimulation are mediated by the release of norepinephrine from nerve terminals, which then activate adrenergic receptors on postsynaptic sites. Also, in response to a variety of stimuli, such as stress, the adrenal medulla releases epinephrine, which is transported in the blood to target tissues. So in other words, epinephrine acts as a hormone, whereas norepinephrine acts as a neurotransmitter. Drugs that mimic the actions of epinephrine or norepinephrine are called sympathomimetic drugs. So let's sketch in our recurring symbol for drugs that mimic the effects of the autonomic nervous system, a mime. But this time, it'll be reenacting the classic fight-or-flight scenario, getting chased by a bear. So all of the drugs in this sketch will ramp up the sympathetic nervous system, activating that flight-or-fight response. So all of the sympathomimetics can be grouped by the spectrum of receptors that they activate. So at this sympathetic summer camp, we're going to depict these receptors in front of our four cabins: alpha 1, alpha 2, beta 1, and beta 2. And in front of these cabins, we're going to highlight the distinct mode of action and the end organ effects of each of these adrenoreceptor subtypes. Just like muscarinic receptors, adrenergic receptors are coupled to G proteins that function as transducers. And each G protein class leads to a specific set of intracellular messages. See the sail on this makeshift raft, and as in an awkward first kiss at summer camp. And it looks like these two star-crossed lovers from the rival alpha and beta camps have carried out a carefully planned getaway. KISS, spelled Q-I-S-S, represents the G protein class coupled with each adrenergic receptor subtype in order. Alpha 1, alpha 2, beta 1, and beta 2 are coupled to GQ, GI, GS, and GS, respectively. Right, let's discuss the end organ effects of each adrenoreceptor subtype, starting with the alpha receptors. Over on the left side of the river is the Alpha Scout encampment. These khaki overachievers have noticed that one of their scout brothers has gone missing, and the search is on. At the Alpha 1 cabin, first take notice that there is one lit candle. In future sketches, when we want to convey alpha 1 activity, we'll sketch in a single lit candle with an alpha-shaped wick, like this one. And just like M1 and M3 receptors, alpha 1 receptors are coupled to GQ, which means that they activate the IP3-DAG pathway, or as we at Sketchy call it, the 3-DAGs pathway, which will be represented by these three bloodhounds, hot on the trail of the missing scout. Because this pathway leads to increased intracellular calcium, one of the dogs is holding a calcium bone. Remember that all this calcium release activates smooth muscle cells, such as those in vasculature and sphincters. In fact, alpha 1 receptors are widely expressed in vascular beds, and their activation leads to arterial and venous vasoconstriction. See the red leashes pulled taut as the bloodhounds stagger forward? This represents the increase in peripheral arterial resistance due to alpha 1 activation. Specifically, we've designed the leashes to resemble constricted small arteries or arterioles and precapillary sphincters, which leads to a dose-dependent elevation in blood pressure. These blood pressure effects are depicted here by this map elevated by this scout, representing an increase in MAP, or mean arterial pressure. Whenever we want to convey that a drug causes a rise in blood pressure, we'll include one of these elevated maps. Alright, recall that alpha 1 receptor activation also leads to venous vasoconstriction. So let's sketch in another alpha scout manning yet another pack of bloodhounds, and this time with tight blue leashes, resembling constricted veins. This leads to decreased venous capacitance and increases venous return, which is useful when combating hypovolemic or distributive shock, and thus altogether minimizing any significant changes in cardiac output that may be caused by reflex bradycardia. As the next scout in the search party gazes through his binoculars, notice his dilated pupils. Remember, we're talking increased calcium here, so smooth muscle is getting activated, and specifically the pupillary dilator muscle, which contains alpha-1 receptors and causes mydriasis. Also, notice as he pulls a little overzealously on the drawstrings of his pants, remember that alpha-1 activation results in the constriction of smooth muscle and sphincters in the genitourinary tract, including the prostate and urethra. And this contributes to urinary retention. See that tightly closed bladder canteen? That's not emptying anytime soon. Let's move on to the Alpha-2 cabin, indicated by the 2 lit candles with alpha wicks. These beige backstabbers could care less about their fellow scouts' disappearance. In fact, they've left them with a subtle yet impactful message: crossed out sympathy. Alpha-2 agonists are sympatholytics because when given systemically, they act on central alpha-2 receptors, decreasing sympathetic tone and reducing blood pressure. Alpha-2 receptors are coupled to the inhibitory regulatory protein GI, and GI causes a decrease in intracellular cyclic AMP levels, and this is represented by the deconstructed camp site as these scouts pack up and head home. These inhibitory alpha-2 receptors can also modulate autonomic activity at adrenergic and cholinergic nerve terminals. These are located at presynaptic sites, thus inhibiting neurotransmitter release. This presynaptic inhibition is highlighted by our scout reeling in this presynaptic wire from the electric hot plate outside. By reeling in the power source, he's depicting alpha-2's role in local negative feedback. Sympathomimetic drugs can also exert numerous effects on metabolism. For example, alpha-2 cells are expressed on pancreatic islet cells, and their activation leads to effects on insulin release. Can you guess what effects it has on insulin release? Well, alpha-2 is inhibitory, so it decreases insulin release. See this mat under the deconstructed tent that used to welcome visitors inside? We'll use this welcome inside mat as our recurring symbol for insulin, because the hormone is responsible for getting glucose inside cells. And as you can see, this welcome mat, now rolled up, depicts decreased insulin activity. Activation of alpha-2 receptors on fat cells leads to decreased lipolysis as well, and inhibits release of fatty acids. See this roasting pig dripping with fat? Well, no time for that now. It's time to move camp, so the fire is doused and lipolysis halted. Alright, one last thing to mention about Alpha-2. The scout dousing the fire is using his hat, which looks disturbingly similar to a large eyeball. Well, alpha-2 receptors are found on the ciliary body in the eye. Some glaucoma medications work by activating these receptors, thereby decreasing aqueous humor production, as depicted by the water draining from the glaucoma cap. At this point, I'll quickly mention a specific alpha-2 agonist used in chronic open-angle glaucoma, brimonidine, represented by the water pouring over the brim of the hat. Brim for brimonidine. Alright, let's move on to the other side of the river, to the Beta camp. Remember Romeo and Juliet down there? It's a tale as old as time. The nerdy yet charming scout woos the most attractive girl at the rival camp, a forbidden love. This runaway is one of the residents from the band camp across the river. And see this sign? Remember, we've covered the Q and I of KISS, and now it's time to discuss the GS-coupled beta-adrenergic receptors. The beta symbol has been associated with the word camp to emphasize that activation of GS-coupled beta receptors results in increased intracellular cyclic AMP levels. And that's also why we've erected some camp tents on this side of the river. At the Beta 1 cabin, the counselor is sounding the bugle because it's time to wake up the camp. In future sketches, we're going to bring this beta-1 bugle back whenever we want to indicate beta-1 activity, usually in relation to effects on the heart. As a matter of fact, her shirt even reads, "I Heart Bandcamp," because beta-1 adrenergic receptors can be found on cardiac myocytes, including the pacemaker cells of the SA and AV nodes. When activated, increased cyclic AMP leads to the influx of calcium, which, in turn, increases contractility and accelerates the heart. Think of the bugle as waking up the heart. Notice how she's holding this clock up in the air? It's our symbol for elevated heart rate, because of increased activity at the SA node. Also notice her buff arm, too? Yeah, I'm a bit jealous as well, and that's why I wear long sleeves. But a strong, flexing arm will be our recurring symbol for increased contractility, due to the activation of cardiac myocytes. In the end, all this beta-1 stuff leads to increased cardiac output, as depicted here by this heart hydrant, pumping water into the river. Finally, beta-1 receptors are also expressed on juxtaglomerular cells. Their activation increases renin release, contributing to the preservation of volume status and blood pressure. It looks like one of the campers here has donned the old yellow rain jacket because of all this heart hydrant hijinks. So whenever it's raining and you see this open yellow rain umbrella, think increased renin. Alright, we made it to the last cabin, the GS-coupled beta-2 receptor. This is an interesting one because even though we're still talking about increasing cyclic AMP, this time, it leads to activation of protein kinase A, which causes relaxation of smooth muscle. See this big dilated tuba? In future sketches, we're going to bring this beta-2 tuba back whenever we want to indicate beta-2 activity. Again, this big dilated tuba should remind you of relaxing smooth muscles. Notice she's taking a huge breath before playing the tuba, which evokes the image of dilated airways. So hopefully this will be a knee-jerk reaction for you. Beta-2 tuba will invoke large dilated airways. The activation of beta-2 receptors also leads to vasodilation in certain vascular beds, including coronary and skeletal muscle arteries. You know, for when you have to run away from the bear. This contributes to a decrease in peripheral resistance, or SVR. And notice that her red sleeves are loose and dilated, just like dilated vasculature. On an exam, you may be shown a blood pressure tracing that distinguishes systolic and diastolic pressure before and after drug administration. Because beta-2 receptors cause that decrease in SVR, you'll see a drop in diastolic pressure. These dangling diamond earrings represent diastolic pressure drop from all that diminished SVR when the drugs have lots of beta-2. This will come into play again later. A couple more beta-2 effects to mention. These receptors are expressed on human fat cells, where they're responsible for activating lipolysis and fatty acid release. Well, here we have another pig, roasting, dripping in fat, but unlike at the Alpha 2 cabin, this time the fire is burning and the lipolysis remains active. Also, someone is pulling marshmallows out of a curiously liver-shaped bag and making s'mores. That glucose leaving the liver represents the increased gluconeogenesis resulting from beta-2 stimulation at the liver. Another girl is bringing a plate of s'mores into the tent with a welcome inside mat. Remember what this represents? That's right, increased insulin, the hormone that brings glucose and s'mores inside of cells. And this occurs because of beta-2 receptor activation at pancreatic islet cells. Next to the girl pulling marshmallows out of a bag are a few banana peels on the ground, and this is because insulin is known to drive potassium into cells. So think of beta-2 receptors generating the same effect. Driving potassium inside cells leads to decreased serum potassium levels, as indicated by our recurring symbol for hypokalemia, spent banana peels. They're banana s'mores, see? Okay, next check out this girl at the side of the cabin. She represents one last beta-2 effect. She's filling water balloons with uncanny resemblance to eyeballs, because activation of beta-2 receptors in the ciliary body of the eye results in increased aqueous humor production. This is how beta antagonists can reduce intraocular pressure in glaucoma, which you'll see in the beta blocker video. Alright, we've been at this for a while, but we're not done yet. there's still a missing scout out there. And just stick with me, and I promise you're going to be able to answer any question about adrenergic drugs or pressure tracings that the exam throws at you. The rest of the scene is dedicated to the different effects of specific sympathomimetic agents. Each drug effect will be outlined based on the spectrum of receptor it activates. And trust me, you'll never look at adrenergic drugs the same way again. Back on the Alpha Scout side of the river, a small search party has stumbled into the tracks of our khaki fugitive. It's a little chilly this morning, so they've outfitted themselves in these flannel overcoats. These matching flannel friends embody the effects of phenylephrine. Phenylephrine are these flannel friends. So phenylephrine is a relatively pure alpha-1 agonist, so that's why our flannel friends are situated under the alpha-1 cabin. Also, we've included our recurring symbol for alpha-1 activation, a single burning candle. Think back to all those alpha-1 effects outlined above, as you'll see phenylephrine is all about that smooth muscle activation. Additionally, alpha-1 receptors are widely expressed in vascular beds in the nasal mucosa. Nasal spray containing phenylephrine is used as a decongestant. Because of local vasoconstriction, it reduces edema of the nasal mucosa. Even with a cold, these flannel friends leave no man behind. Also, notice that the scout on his shoulders is gazing through those mydriasis binoculars, depicting phenylephrine's ability to activate the pupillary dilator muscle, making it a useful mydriatic agent for ophthalmologists. Remember, systemic administration of alpha-1 agonists can lead to arterial and venous vasoconstriction, so phenylephrine can be used as a pressor agent to increase SVR and therefore increase blood pressure. Again, we raised our mean arterial pressure map to indicate the dose-dependent rise in blood pressure, also depicting the increased systolic and diastolic tracings that you may encounter on an exam. Again, phenylephrine is used in cases of hypovolemia and distributive shock to increase SVR and increase venous return in order to maintain cardiac output. In these cases of shock, vasoconstricting agents like phenylephrine can be life-saving. So this boost in blood pressure from alpha-1 agonists stretches baroreceptors in the vasculature and mediates a reflexive increase in vagal tone, causing slowing of the heart rate. Whenever we want to convey this reflex bradycardia, we'll sketch in a dangling heart stopwatch. This stopwatch is dangling low to the ground to represent a drop in heart rate. Remember these baroreceptor-mediated mechanisms, they're going to come into play again when we discuss the alpha-1 agonist pressor agents. Also, keep in mind that patients with reduced autonomic function, such as those with diabetic neuropathy, can't elicit these baroreceptor reflexes, and this results in dramatically exaggerated pressure responses to sympathomimetic drugs. Next to our flannel friends is the scout leader, using a compass to get his bearings. This north-facing compass will represent that he embodies the effects of norepinephrine, rather than epinephrine, which we'll cover later. Norepinephrine is an agonist at both alpha-1 and alpha-2 receptors, and that's why he's situated on the Alpha Scout side of the river. He's blowing a bugle with his muscle flexing that's holding the bugle, and he's making the bugle call because he found some tracks of their lost friend. While mostly alpha, norepinephrine also has some beta-1 activity, and that's why he's sounding the beta-1 bugle the moment he spots the tracks of their missing friend. Again, if we think back to the adrenergic effects outlined above, it's easy to guess what norepinephrine's end organ effects are. Agents with mostly alpha-1 effects cause that vasoconstriction, increase in SVR and blood pressure, and again this increase in systolic and diastolic pressure is indicated on his elevated mean arterial pressure map. As with phenylephrine, the pressure-inducing alpha-1 effects are somewhat counteracted by a reflexive bradycardia, as indicated by this dangling heart pocket watch. Unlike phenylephrine, however, we also need to throw in some beta-1 effects. Because norepinephrine has predominantly alpha effects, that reflexive bradycardia I just mentioned eventually supersedes any beta-1 heart acceleration. However, the beta-1 contractility effects are maintained. So remember that norepinephrine is associated with increased stroke volume and cardiac output, as indicated by his buff flexing bugle arm. Because of their potent alpha effects, phenylephrine and norepinephrine can both be used in cases of hypovolemic or distributive shock, where vasoconstricting agents can provide life-saving increased SVR and increased venous return. One example, embodied in this likely unauthorized septic tank line, is septic shock, when vasodilation needs to be counteracted so you can get blood back to the heart. Whenever you see our lightning bolt symbol, think shock. Over on the beta side of the river, some of the band members are also searching for their missing friend, and notice this beta band member is wearing a pretty intense Just Do Bugling shirt. She represents dobutamine, represented by Do Bugling, an agent that exhibits mostly beta-1 effects, which is why she's situated under the beta-1 cabin. Besides Just Do Bugling, I also try to remember that dobutamine sounds like Do Beta-1. So let's keep all those beta-1 heart effects in mind, which are increased heart rate, increased contractility, and overall increased cardiac output. So that's all just ramping up the heart, which is depicted here as she forcefully winds up her crank-powered heart flashlight. So dobutamine is useful for activating the heart to treat refractory heart failure, for example. Because dobutamine exhibits some beta-2 activity, let's sketch in her small companion holding a beta-2 tuba. Remember that beta-2 causes dilation, thus reducing vascular resistance. But with only minor activation by dobutamine, these decreased SVR effects are minimal. So take a look at dobutamine's map tracing. I want to emphasize the shape. Drugs that act on beta-1 receptors cause an increase in contractility, leading to an increase in pulse pressure, which is the distance between the systolic and diastolic lines. See that shape? Think of it as a bulging bicep that pushes the lines apart as the heart fills more and pumps more. In fact, for any drug that overlaps with some beta-1 activity, look for this increased pulse pressure. Like over in that norepinephrine trace, not only did systolic and diastolic increase, but that pulse pressure between them increased as well, because of a little beta-1 thrown in the mix. Agents that act on beta-1, such as dobutamine, are useful for treating acute heart failure or cardiogenic shock. In these cases, inotropic agents can provide life-saving increases in stroke volume and blood flow to tissue. Think of recharging the heart, kind of like putting the batteries back into this failing cardiac flashlight. And the heart shape next to the lightning bolt symbols on the batteries should remind you of cardiogenic shock. Remember, all these chronotropic and inotropic effects also increases the heart's oxygen demand, just like all that vigorous flashlight winding would. This increased myocardial work makes dobutamine useful for revealing areas of ischemia on a cardiac stress test. So dobutamine is often used when people can't physically exercise for these stress tests. Okay, behind the dobutamine girls, it looks like we've got some pretty extensive tent building going on. A beta-1 camper and a beta-2 camper have joined forces, creating a tunnel between their tents, an isopro tunnel, if you will. It represents isoproterenol, a potent beta-1 and beta-2 agonist. It's the best of both worlds, really. The heart rate and contractility effects of beta-1, as represented by our not-so-happy early riser holding up the heart alarm clock, in addition to the vasodilatory effects of beta-2. See those dilated sleeves again? Whenever a drug overlaps with beta-2, think of the resultant pressure tracing. Dilating small arteries causes the diastolic pressure to stay low, as you can see by this girl's dangling diamond earrings. It's to remind you that the beta-2 receptors cause a decrease in SVR, leading to a dropping out of the diastolic pressure. So think dangling diastolic diamonds. The resultant pressure trace is depicted in the shape of the isopro tunnel itself. See how the mean pressure decreases because of that dropping out of the diastolic pressure? Think of it as a floppy, dilated vessel, sagging and bringing the diastolic down. Remember, because isoproterenol also exhibits potent beta-1 activity, we have that bulging bicep of a pulse pressure, keeping the systolic relatively unchanged. In case you haven't noticed, a lot of those beta-2 girls are flaunting those dangling diastolic diamonds, just as a little reminder of that sagging diastolic whenever beta-2 is involved. Situated exclusively under the beta-2 cabin, we have a few beta-2 selective agents to mention. See the camp counselor asleep on the hammock, undoubtedly in the late stages of pregnancy? She represents beta-2 agents that relax the uterus, useful for short-term suppression of premature labor. So she's in her tranquil, happy place. Leave her alone. Her do not disturb sign should remind you of terbutaline, and her I dream of Bandcamp represents the agent ridodrine. Agents with beta-2 activity can dilate bronchial smooth muscle, making them useful in treatment of asthma and COPD. I just want to quickly remind you that many of these beta-2 agonists, albuterol for example, end with ROL. So we have our deep breathing beta tuba player holding a roll call sheet. Roll to remind you of the drugs ending in ROL. We'll cover asthma treatments more extensively in a later video. Okay, we're going to bring this sketch to a close with these star-crossed lovers themselves, here to represent epinephrine. Notice that the name epinephrine is highlighted on this Runaway Scouts badges, which read Epic Summer. Think epic for epinephrine. And it looks like he's ready for an epic kiss as well. Unlike the campus-wielding norepinephrine, who hangs out mostly on the alpha side, epinephrine is a potent agonist at both alpha and beta receptors, and is therefore an effective vasoconstrictor and cardiac stimulant. In fact, it's dose-dependent, which is why we've made the raft visibly tilting toward the beta side. At low doses, you've got predominantly beta effects. Just take a look at the low side of the raft. And this is probably because the Bandcamp girl has brought along her weighty beta tuba. She's embarrassed about the kiss, and her head is turned away. She's using an inhaler, which emphasizes the important beta-2 bronchial dilation that makes epinephrine useful for opening up airways. She's a little nervous, of course, and just needs a few quick puffs of her inhaler. Beta-2 effects can also lead to some vasodilation, and remember that this can drop that diastolic pressure. This is one classy dude, of course, and he's brought her a diastolic diamond ring. Notice, however, that it's tumbling off toward the beta side of the raft, and this is to remind you of the drop in diastolic pressure, and this can be especially apparent in low doses of epinephrine, when beta effects predominate. As she offers him a gift in return, she displays the important beta-1 effects of epinephrine as well, the elevated heart rate clock and the flexed cardiac output bicep. Epinephrine's potent ionotropic and chronotropic effects make it useful during resuscitation from cardiac arrest and shock. As we continue toward the elevated side of the raft, we're conveying the effects of higher and higher doses of epinephrine, when more alpha effects start to dominate. This means vasoconstriction, increased SVR, and a significant increase in blood pressure. Okay, let's put all these effects together on this map in front of them. So as I said, when epinephrine is given at low doses, the beta effects predominate, as you can see by this vasodilatory diastolic drop, and that buff increase in pulse pressure. And once you start getting into the alpha effects, you get an overall boost in blood pressure as well. The trace, accordingly, looks kind of in between the rising alpha tracings and the big slumping beta tracings. Once you put all these effects together, it's easy to see why epinephrine is the drug of choice for anaphylactic shock. Alpha-1 counteracts that vasodilation, beta-1 improves blood flow to tissues, and beta-2 opens up those airways. You know, love can be a lot like anaphylaxis, and that's why they've painted their names Anna plus Phil on their secret getaway raft. And remember, the lightning bolt means shock. So Anna and Phil's epic summer should remind you to use epinephrine during anaphylaxis. And finally, we've arrived at the end of the sketch. As you're reviewing, remember to really understand the pressure tracings. Not only should you be able to deduce which alpha or beta agonist is given, but you should also be able to reason through what happens when an alpha or beta blocker is given. For example, let's say you're shown the tracing for epinephrine, but then a mysterious blocker was given. Is it an alpha or beta antagonist? Well, if the heart rate increases, pulse pressure opens up, and that diastolic bottoms out, use your hand to cover the left side of the sketch, and that's right, you've blocked all those alpha effects. If the pulse pressure narrows and the pressures shoot up, leading to reflex bradycardia, well, now you've blocked all those beta effects on the right. So feel free to spend some time to really master alpha and beta effects. They'll absolutely be tested on your exams, and it's a fundamental concept of pharmacology. I know the sketch was long, but I really hope you enjoyed it.